Carter. Welcome to House Calls, brought to you by KaMMCO, where Kansas healthcare professionals deliver health insight. Today I'm speaking with Dr. Jennifer Kuntz of Newton about cold and flu season. Thanks for being here today, Dr. Kuntz.
Thanks for having me.
Let's just start with, what is the difference between a cold and the flu?
Well, it's a good question because they're very commonly confused. And I just want to clarify, when we're talking about the flu, we're talking about influenza and not the stomach flu.
Okay.
But both the cold and the flu are respiratory illnesses caused by certain viruses. A cold is usually milder and doesn't last as long, and the flu is usually more severe.
What are some symptoms of a cold that you should look for?
Yeah, symptoms of a cold are usually cough, congestion, runny nose, and sometimes fatigue. Sometimes you can get a fever, but it shouldn't be higher than 101 degrees usually.
And what about the flu?
The flu is usually much more severe. You can get a sore throat, high fever, body aches, headache, cough and congestion. Sometimes you get vomiting and diarrhea, but not commonly. The other thing is that flu can sometimes lead to serious pneumonia and hospitalization. That's why we often give the flu shot every year. It can help prevent the flu or lessen the severity of it.
Okay. And how are both typically treated?
Well, we usually treat the cold symptomatically, and that would involve rest, Tylenol, and sometimes over-the-counter decongestants. A flu can be treated with a prescription medication if it's diagnosed within the first 48 hours of when your symptoms started. Both are very contagious, so it's important to wash your hands frequently to avoid spread of the disease.
And should you ever call your doctor?
Yes, definitely. If your symptoms are severe or lead to chest pain, trouble breathing, or persistent vomiting, definitely call your doctor.
Okay, great information. Thank you for being here.
Thank you.
Please join us next week for a new health topic discussion on House Call.